Good afternoon. How many of you, when you heard that your next patient is a psychiatric one, somebody who may be having depression, anxiety, insomnia, bulimia, Tourette syndrome, think, why me? Why me? So I like to, in my talk, I like to kind of convince you to the opposite. I like you to begin to think that I want to see my next psychiatric patient because I can do so much for him, much more than most of the conventional psychiatrists. So, is it working? Sorry, it's not working. Okay. Okay. Okay, the other one, up. Okay. Oh, that's a problem. If you press the wrong button, it's never going to go through. Okay, good. Okay, so conventional psychiatry has been actually far behind most of the medicine. And if you think about it, the diagnosis is still very subjective, made by the psychiatrists based on the criteria which are presented to them. But those criteria, those diagnostic criteria developed nowadays by people with their closest association to pharmaceutical industry, they're ever-changing and expanding. And if you like, I've been in psychiatry for 30 years or so. If you like, I can spend 5 minutes with each one of you here and give you a couple of diagnostic labels. No problem. The agreement among psychiatrists, what constitutes for every patient the particular diagnosis is quite low, about 20 to 30%. And as you probably know, in psychiatry, we don't ask what the etiology of a particular condition is. And actually, absolute majority of psychiatric diagnoses don't have one. There is no objective diagnostic criteria. There is no laboratory testing. So basically, it's very easy to invent the diagnosis. Medications, most of the medications are tested for 4 to 6 weeks. However, psychiatrists usually recommend them for the lifetime. Polypharmacy or use of multiple medications is now a norm. Most of the people with the complicated psychiatric conditions like schizophrenia, bipolar, depression are on 2 to 5 medications. Most of my patients come even on more. Resolution of the condition is almost never expected. It's basically you are on a maintenance. And psychiatry is more and more dependent on a big pharma. So the corruption issue is quite significant, et cetera, et cetera. This is not to talk about that, but I can give a number of lectures. If you like a couple of good books written by investigative reporter Robert Whitaker, who actually who did magnificent research and wrote 2 great books. So, but what can neural therapy offer for psychiatric patients? And that's what I would like to talk about. Number one, we can address primary etiological issue. What have caused the condition? Quite often it can be scars, visible, invisible, periosteum scars. And I'm going to give you examples. It can be a functional conditions like bulimia, Tourette syndrome. It can be neural therapy can also be an integral part of other treatment that is administered. Let's say hormonal imbalances, infections, toxicity, etc. So what was interesting to me that I have not found up until 6 years into doing neural therapy that actually it is contraindicated for psychiatric patients. But then it was too late. And anyway, I'm a bit of a rebel. But the question for me was why neural therapy is contraindicated for psychiatric patients. It can be just hypothesis that maybe Huneker brothers were dentists with the misgiving of psychiatric patients. So, and as we know, psychiatric patients quite often more difficult to deal with. They can have some unpredictable reactions. And basically, they require more time occasionally. Now, so where can neural therapy step in? Number one, I've already mentioned scars. So what do you do? When you find a scar, you want to ask patients to close their eyes and connect their emotions which happened during the scar. Because every scar has an emotional issue. And while the emotions are connected, then it is the time to inject. It's important to use some homeopathic remedies, heal remedies, for example, which can potentiate your effect. At the end of the treatment, when patient is going through their memories and reliving some of them, it's easy to use a procedure EMDR, eye movement desensitization and reprocessing. Basically, when patient is lying there, you just have your arm, you show number 8 for about 30 seconds. That helps to relieve a lot of emotions. You also can ask patient to breathe all the emotions out through their body, which also helps to release them. Scars can be visible, and then it's, of course, easy to find them. And the most important scars, well, already Dr. Chang mentioned C scars, episiotomy scars, scars, cuts, surgeries, all kind of infection scars. Those are easy to find, they are identifiable. Invisible scars, like infections, vaccinations, or periosteum scars, you need some certain tools, and we're going to talk about, and Dr. Chang have demonstrated how they can be found. So let me give you an example. A 28-year-old woman came to my office. She had a history of bipolar disorder for 6 years. She was on 4 psychotropic medications, and in spite of that, she was highly unstable. Mood fluctuations, irritability, anger. Since she was a little kid, she was the only child, parents always argued. There was a police in their door. So it was pretty traumatic for her. So she escaped the family, got married, and was 9 months pregnant when she came to visit her parents. And of course, there was a fight. So her waters broke. She was taken to the hospital, and an inexperienced resident gave her a big C-section scar. It was very traumatic. Within 2 weeks, she became depressed. She was put on Paxil. It's an antidepressant. And what is known that most of antidepressants have a possibility to cause bipolar episode. So, or manic episode. So within 4 months, she became manic and psychotic. She needed to be hospitalized. It was very painful. In the hospital, she was assaulted by another patient. So what I did on second visit, I asked patient to close her eyes, imagine this surgery, and while she was kind of imagining it, I gave her a simple injection. There was an immediate strong response. Patient was flooded with memory. She was overwhelmed, she was crying there. She felt she never was accepted, and parents always fought, and she was always in the middle. So all her traumas kind of came up. So I did EMDR and asked her to breathe. It took about 30 minutes. The scar was injected another 3 times. And after that, I was able to taper most of her medications. Another thing, invisible scar. They are much more difficult to find. So the case in point, M was a 72 years old businessman who came to me. He was retired. He was quite successful in his business. However, he chose to retire at the age of 50 because it was kind of difficult for him to function. He was anxious. He has lifelong anxiety, insomnia, depression. He has been treated with multiple courses of psychotherapy, medications. Nothing was working. I did initially try my usual tools, helping him with herbs, supplements. Nothing was working. So then I did APN. It's one of the methods where you can connect the emotions with and find the timing when it happened. So it's done with a muscle testing. It's one of the techniques that Dr. Kleinhardt have developed. And I was able to identify that there was a trauma that happened to him at the age of 3 or 4. I asked him, did anything happen? He told, no. However, that night, he talked to his older sister, and she told him, of course, when you were 3 years old, you developed a high fever. You were taken to the emergency room of the hospital. The doctor did a spinal tap. And because they were concerned that you have an infection, the parents were not allowed to see you for 3 days. When you came home, you never been the same. And since that time, he had a lifelong insomnia. So using my hands, using RT tool, I was able to find a point where the injection was done. I did an injection, and patient had an immediate severe response. He regressed to the age of 3. He was talking as a little kid, calling for his mommy to come. We repeated the injections several more times with ever diminishing response. After that, I was able to decrease to get him most of his medications. Now, how to find an invisible scar. So we all need to become MDs, which stands for medical detective. So what are the skills of medical detective? It's number one, it is our medical expertise and our intuition. So, and the intuition is the best when it's guided by some sort of energetic tool. And I'm kind of, and this energetic tool, like we have seen with ART, can provide an immediate answer, yes or no. It's like what we have in our computers. So I use a couple of tools, and I name this kind of approach BET, B-E-T, bioresonance energetic testing. And it includes two modalities, two energetic modalities. One, I'm sorry?
Are MDs allowed to bet?
They have to. So one is autonomic response testing, which I modified, and I talk a little bit about it. And then modified BAH. So most of you know ART, but few people know BAH. It is a bioresonance analysis of health method developed by Thomas Schulz using Leher's antenna. And this is Dr. Kleinhardt. So modified ART. So basically, I had an issue. So first of all, when you do it with a patient hand, it's sort of unreliable. So you need to have a second person, like Dr. Chang, who has a big office. Several people are following him. So he is a big guy. He can afford it. So I'm a little guy, so I had my secretary, and she would come, and I would work with her hand. And then she began to complain. You know, I cannot do it anymore. So I was stuck, what to do. So I decided, let me try kind of develop modification of that. And modification is doing with my finger. And you can actually train yourself depending on the finger. This is the strongest one, this is middle, this is what I'm using most of the time, and this is the for most sensitive points. And actually that serves as a muscle testing, as a ART. I'm using all the tools of ART, but this one makes it so much more easier. So that was the first modification. The second one was with the biofilter. So as you notice, usually they just put it on a particular number and it stays there. However, what is known that depending how well patient is, you can open the angle more or less. So and this is the diaphragm. So if the patient is completely well, then the angle is about 85 degrees. If the patient is doing poorly, then the angle is about 5 degrees. So you can right away, within 2 seconds, know how sick the patient is. Another thing with that basically, if you have, let's say, 10 scars, you can find out which scar is more important using the filter. And it basically, if patient is blocked, so when the field becomes open, you can see how important it is. So if it's closer to 90 degrees, you know that a particular scar is more important than the scar that opens just to 10 degrees or so. The same thing applicable to all other pathologies. You can measure it in terms of microorganisms or toxicity. It's basically easy tool to use. So advantages of this modified ART, that basically in only 5% of the times, and only when I'm tired at the end of the day, I need a third person to confirm what I found. It's a fast testing because you have kind of your hands, and if with the hand you have only few points you can test. Here it's kind of almost like unlimited amount of points you can test. So you can take a bird view of what's happening with the patient. And you can have a numerical identification how significant the issue is. Disadvantages, like with all ART testing, it is unstructured and it's based on your own intuition. So what if you have a scar, you injected it many times and it does not respond? So the case in point, 70 years old psychiatrist whom I know quite well. She is a lung cancer survivor. She has a lifelong insomnia, and for years she has been on 4 or so medications that she takes at night. So her story was that at age of 5, boiling water was spilled on her left arm and induced a big scar. And that night she saw that somebody came to her room and just tear the skin off her hand. Since that time, she was not able to sleep for 65 years without sleeping medications. So I injected this scar 4 times with procaine, nothing happened. So I needed to find out what am I missing. So I employed my second tool, BAH, Bioresonance Analysis of Health, which is done with Lecher's antenna. It's a physical instrument developed by Professor Lecher from Vienna in 1926, and was adapted to serve in medical practice. Basically, it's much more accurate than the just muscle testing, and so you can just do it with take from patient was just a little bit of patient blood. And then using questionnaire, you can go through all very well organized questions which include toxicity, tissue pH, multiple events that happened, allergies, pathogens, nutritional issues, and you can also establish dysfunctional priority. Because if you have a lot of tools, where to start with? And then you go to the second page, and then you choose supplements, neural therapy, IV therapy, whatever you are using in your office, and you can adjust it to your practice. So it's a very German way, very structured way to do evaluation. So you can also, with this tool, while patient is holding the base, you can find out which homeopathic remedies you're going to inject. You can find out what supplements patient will use. So once again, it's very helpful. You can also ask a question while patient is holding it, what's going on? What am I missing? And usually you get some response. So in this particular case, she did not respond to injections, so I needed to find out what's going on. And the answer was that the scar was impregnated with mercury, because she had at one point more than 12 amalgam fillings. So the scar was injected with DMPS, and after 4 injections, basically, I was able to taper most of her medications. She has been sleeping well, but because there is a habit, so she continued to take small doses of Xanax as her security for a good sleep. Periosteum scars. Periosteum scars hold a lifelong memory, and periosteum scars are connected to the whole body through the network of periosteum. They're invisible, and once again, they can be easily found using BET or ART. The case in point, um, 7-year-old boy who came to me because he had a severe tardive dyskinesia. He was born with a Lyme because his mom had Lyme, and she is now a very experienced Lyme practitioner. So he did not receive any antibiotics. However, he had a mild tics. And he was a very athletic, charismatic boy, very bright, always kind of admired by his teachers and peers. But at the age of 5, he had a femur fracture. He needed to put in a wheelchair. And within 2 months, he developed severe TD symptoms. Because he had this movements and screams in the middle of classes, he was expelled from 2 private schools. So when I saw him, it was easy to identify this femur scar. And actually, you can outline how big the area this scar is covering. So initially, it was a pretty big area. So I injected the scar, and there was immediate response. The mom called me the same night that his whole tics have kind of almost stopped. 2 weeks later, we scheduled a follow-up visit, but it was a long kind of, they had to, it takes 2.5 hours to come to my office. The kid didn't want to go. He wanted to go to school, and his tics have returned. So when he came for an appointment, 2 months later, I began to kind of investigate, what am I missing? How come this return? This scar on a femur was still active, so I needed to inject it. But as I was investigating, I noticed that there is an interference field behind his ears. So I asked father, he had a frequent ear infections? No. So, and then father remembered that when he was born, it was a very difficult birth, and doctor had to apply forceps to get him out. So it was clearly scar from the forceps. I injected the scar and injected his femur, and I have not seen him for 6 months because he was in almost complete remission. He followed with me every few months, and he was doing exceptionally well. I didn't need to do too many other injections. But recently he had another fracture, and mom called me about a month ago that some of his symptoms have returned. So I have not seen him yet, but I'm sure that another scar somehow connected there as well. So, what are the lessons from the scars? The older the scar, the more influence it has on our physical and emotional health. The more traumatic was the experience, the more emotions can be released while we're doing it. And it is important when we inject a scar to connect emotions with the injection itself. And then if you have a scar which does not respond, suspect some heavy metals or infection. So what is neural therapy role in treating psychiatric conditions? So number one, as you've seen with the scars, we can resolve them. We can resolve psychiatric condition. Number two, the neural therapy can play a supportive role in other treatment methods. So let me give you another example of functional condition, bulimia. So 46-year-old executive came to me. She had a history of bulimia for 20 years. She has been taking care in our office with acupuncture, with diet. However, her bulimia persisted. And I knew I have only a short visit with her. So also her history was, which is very typical for bulimic patients, that she had a sexual abuse. She was suffering from depression. Her father committed suicide. She has been on multiple medications over the years. She had to take TAMS and H2 blockers every day, and she vomited every day. She of course have been treated by many different practitioners. So at the time of our first injections, I knew her history from from Tia, who was taking care of her. I found she had a scar on her face, so I injected it, and there was a big interference field where her esophagus is and stomach. So I injected that area as well. Then I gave her thyroid injection, IV, Procaine, and then of course it was APN and a little bit of EMDR, helping her to resolve some emotions. There was a lightening reaction. After this treatment, patient had never had another bulimia episode. So, and we've been following her for over a year. So, neural therapy can also be used in conjunction with other methods, herbs, supplements, energy, psychology, acupuncture, IV therapy, bioresonance technology, homeopathy, LDI, you name it. A case in point. A young 23-year-old lady came to me. She had a history of self-cutting almost on a daily basis. She was depressed on several medications. She made several suicidal attempts. She had a sexual confusion. She didn't know what orientation she is a homosexual or she has suffered from PCOS, and she was hypersexual. She was on 3 psychotropic medications. And she failed multiple treatment modalities as well. So in our office, she receives supplements, acupuncture, guided imagery, APN, helping her to resolve her emotions, dietary changes. She was on UNDA protocol for her PCOS. And then I gave her several injections into Frankenhauser plexus or plexus uterovaginalis, thyroid, adenoid, and segmental therapy. Within 1 month, she stopped her self-cutting and her suicidal ideations has stopped. And within 3 months, her menstrual period was back. She was tapered off her psychotropic medications. We've been following her for about 4 years, and she is doing very well. So additional ways to use neural therapy. So one of the most investigated way to use neural therapy is for stellate ganglion injection. Actually, it is done in VA hospital. However, they don't call it neural therapy. They don't know what neural therapy is, and they do it, of course, under the guidance of fluoroscopy, which is pretty expensive, and it's done only by anesthesiologists. Then thyroid gland injections are very helpful for patients with panic attacks, with anxiety. Crown of thorns, easy to administer injection, helpful for many conditions. And actually, crown of thorns, when it's given together with a honeybee venom, is very helpful for multiple infections. Superior cervical ganglia, as per very helpful for depression and particularly for the recurrent depression. So I learned about this stellate ganglion injection. However, nobody was teaching me how to do it. So I didn't know how to do it, and so I needed to organize a workshop here, and I invited 2 excellent teachers, and we had a whole group of people who were with us, Dr. Uli Aldak and Dr. Hans Pierre. He's right here. He gave us excellent workshop, and close to 30 people attended at least one workshop, and this is our last class. So what are side effects of neural therapy in terms of psychiatry? Practically no to usually what is expected. However, be ready for some emotional reaction. And some people, of course, experience some anxiety, so they need to be reassured. Hand-holding is very helpful. But most patients are highly appreciated for giving them neural therapy. And as one of my grateful patients pointed out, neural therapy is an acupuncture on steroids. So, conclusions. It is my opinion, and I've been doing psychiatry for 30 years, that neural therapy is the best tool in psychiatry. As opposed to many other tools psychiatry utilizing now, neural therapy can resolve a number of psychiatric conditions. Reactions occasionally, but they can be strong. But there is no need to be afraid of them. Exacerbation of psychiatric conditions, I practically have never seen any. Neural therapy is safe and effective psychiatric tool. Patients are usually grateful, and it should become must-use tool in psychiatry. And the final thing, because psychiatrists are afraid of needles, but you are not. I think you would be the best psychiatrist in the world. Thank you.